Hi everyone, my name is Anna at Migrant Doctor Mom, and I'm so glad you could find time to join me on yet another video. And today I'm just essentially hoping to talk to, the international medical graduates that are wishing to do a clinical observership in Australia. So the topic today is essentially tips on how to have a successful clinical observership position in Australia. So you don't only want to have a clinical observer position, but you also want to be able to leave an impact and have a successful clinical observership. So, and like I always say, a clinical observership allows you, and it gives you an opportunity to see how the Australian system works. It gives you an opportunity to make meaningful relations and get yourself some good references. And it also just allows you, and in most times than not, allows you to even have a job offer. So if you're thinking about clinical observership, yes, it can be costly, especially if you're overseas. Yes, it can be hard to find one, but I think it is very meaningful, especially if you're an IMG, and especially, and most times than not, it will be that you'll be wanting to get your first job. So it is very important if you're able to do one, to do one. Okay. And remember, we are hoping that you do one, but you're also successful. So these are some of the tips that I would say, being somebody that has been on the program, but also having watched and observed. And sometimes you look at, people come through your department doing observership, and you actually notice that the bosses are, can pick out who's a good observer and who's not. And I say this because I was an observer before, and sometimes you go in thinking, oh, my role is just to observe. That's not true, because sometimes, without knowing, you're coming from a point of no knowledge. You just go in and you think you're going to sit in a corner and just look like, the way they say, a fly on the wall. No, you're not a fly on the wall. You are essentially, mingling in with the team, learning the ropes of the job, but at the same time, you're not going to just be silent. You sort of need to voice your opinions every now and then, listening, and just be a part of the team. So these are some of the tips that have been helpful to me in the past, but I think that I have seen, and sometimes I see people doing things on their when they're given an opportunity to observe, and I'm just like, oh, it's good to know. It's good to know these things, because then if you know, you're able to do a better job at whatever you do, really. So the first thing that I have noticed, and I must emphasize on, is time management. As an observer, look, you have no obligation, like no obligation like the rostered doctors. The rostered doctors would be expected to be there, let's say 7:30 to 3:30 or 8 to 4. They'll be obligated to, round with the team, do discharge summaries as RMOs. Every now and then they'll be expected to consult. They'll be expected to do skills like cannulations and stuff like that. Obviously, as an observer, there are some things that you cannot do, and the hospitals will tell you the things that you cannot do. But I still want to say this, because this is something that I have seen in terms of time management. As much as no one, you are not obligated to be there the specified amounts of time, but I would say, as part of the team, be there. Okay, do not arrive to handovers late, do not leave early, because that just, remember, as much as you're observing people, they are observing you as well. They are observing you as somebody that could be the part of their team in future. So whatever you're displaying as an observer is probably what you're going to display when you start working. So it's very important to ensure that you're arriving to work on time, and you're leaving when everybody else is leaving. The business of leaving before your bosses or leaving before your registrar leaves, probably doesn't sit very well with you. Remember, people will smile with you, laugh with you, but at the end of the day, when they're asked to give an evaluation or an assessment about you, those are some of the things people will remember. People will remember that she came early, she stayed behind, she offered to help, she offered to do 1, 2, 3, she offered to take bloods, a few things here and there. People will remember that and they'll put in a good word for you. So remember to keep time, come to work on time, leave when everybody else is leaving or has left, and just develop that habit of teaching yourself that an RMO job is from this time to this time. So you're gonna leave and stay as long as the RMOs are staying, and leaving yeah, as when they leave. The other thing that I must say, the second tip is you have to be proactive, you know. I think the thing that people come in on board thinking is, as an observer, I'm not supposed to do anything. No, remember, you still need to be proactive. If it's a teaching hospital, and most of the bosses will tend to teach on the run, so they will, during rounds and during staff, you'll get people that are asking questions here and there. If you know the answer to a question, you know answer it. Be proactive enough that you can answer questions, you can offer solutions. Sometimes you can give your experiences. This is how we do it in my job. This is how I would do things. This is if someone is struggling with a cannulation, your RM is struggling with a cannulation, and from where you're coming from, your experience in the area of cannulation, this is the time to give some of the tips that you go like, oh, this is an older client patient, probably you need to pull back a little bit, be nice and relaxed. This is this is how you're going to do it. So by being proactive and helping, and meeting a need where there is a need, just puts you in that situation where people are seeing you to be more beneficial to the team. So don't see a need and you have the means to meet the need and just do nothing. So if the team is thinking about a certain project, and you have the skills, look, simple things like you may be good at electronics and the printer is acting up. Look, stand up, say, look, let me try, and try and see if you can fix one or two things. So sometimes just being proactive puts you a little bit above above bar compared to the other people that have gone through. And people may just remember you as the guy that would normally fix the printers, or the guy that would an IT guru and stuff like that. So bring in your skill and be proactive enough to share your skill. The other thing that I must say is, the other tip is, try and be a team player, and that would be at work and outside work. So provide addition, be an asset to your team, in terms of, like, if the team needs to meet a certain target, like I've said, and they are trying to work through discharges, offer to even provide a bit of support, go through it, summarize it, and and ask your RMO to have a little look. And I feel like being a team player, being somebody that comes in and helps the team meet its target, is a good way to make your observership position more meaningful. Most of the fourth tip is essentially attend teachings. Most of the teaching hospitals will have time to have the mandatory RMO teachings. There will be journal clubs, there will be grand rounds, and there would be an opportunity for you to go to teaching. And the reason why it's helpful to go to teaching is that's where you will learn a few things. Sometimes discussion of the journals, guidelines, current guidelines, that will be adding knowledge to what you already know. So and that's the essence of clinical observership, seeing how people are doing things, seeing, the new guidelines coming out. Sometimes clinical audits will be where people are trying to see what is correctable, and that's an opportunity for you to learn. Sometimes people do sims, which is like, simulation sessions, things like procedures like resuscitation, CPR, a trauma sort of situation simulation. And sometimes if your background is in, emergency medicine, and, you've done these things more, and you can, come out, that's an opportunity for you to show your strengths. That's an opportunity for you to come out and express, what you've done before, how you've done it, and also learn how different people do things, because that's the essence of observership, knowing how people do things, which could be different to what you've always done. And then while I'm at that point of teaching, is offer to do clinical audits and offer to do present a journal club, and sometimes just, finding an interesting case on the ward that is not very common, reading about it and presenting it back to the team, in one of the meetings, be it the journal meetings, be it the morning handovers, be it just find an opportunity. And most times than not, you just need to discuss with your attending and say, look, this is a case that I've seen around the ward. I'm not very conversant with it. I'm going to read about it, come up with a few slides and teach. The beauty of doing that is whatever you teach sticks longer. Whatever you teach remains with you many, many, many days after you've taught. So it gives you an opportunity to teach and remind yourself, but it also gives you an opportunity to show that your communication skills, gives you an opportunity, to express and also just share what you've learned for the benefits of the other members of the team. I cannot reinforce enough the importance of dressing appropriately during your observership position. So obviously, every medical jobs in Australia are a little chilled. We don't wear lab coats. We don't wear long sleeved stuff. So it's an opportunity for you to see how people are dressing up, smart casual, scrubs. In the advent of COVID, a lot of people have taken up to wearing scrubs. You can get yourself a pair of scrubs at a good price. You can come in, appropriately dressed, below, above elbow for infection control purposes, no watches for infection control purposes, and just, mingle up with the team, see what they do and pick what they do and just run along with it. That's the essence. One thing that I've seen, and I just have to say this because I feel like it's going to help somebody, don't be greedy. Do not be greedy when you're doing an observership. Remember, as you quickly get in, your idea may be that you want a job, okay? And everybody knows that. We all know that you're hoping to do the clinical observership so you get a job. And then sometimes you are looking for a job in a place that offers WBA position, like work-based assessment. The way I find it is, somebody is already doing the clinical observership and they're already looking ahead and asking the team or the boss if they will be considered for a WBA position. My thought process is, everything works in tandem, like everything, kila jambo kwa wakati wake, everything at its own timing. Your mind should be thinking about getting a job, full stop. Get a job fast. Once you get a job, once you get your first job, and I'm talking to somebody that has AMC1 English and has work rights, get a job as number one. Once you get a job, then think about doing your AMC2 or doing your WBA. Get in there, leave an impact, let people give you a job. And once they give you a job, then position yourself or strategize yourself so that either you're getting your MC2 or you're getting your WBA position. Don't be one that you're still looking for an observer position, or you're still even in that period where you haven't been incorporated as a member of the team and you're already thinking ahead, look, we all want the best for ourselves. You know, by the time you're doing your clinical observership, you're thinking about your WBA, that's fine. But just get in, get your job, and once you get your job, then push, push, push so that you get your WBA. I feel like, showing your motives so early in time can put people off a little bit because you know I think, yeah, and I have seen that. I've seen people who do that, and I don't think it rubs on really well. I think my advice would be get in, get your job. Once you get your job, then work around getting your WBA position. My last tip is go above and beyond. You cannot be average. And I've always said that. That has always been my policy. You cannot be average like an Australian or a local trained a locally trained graduate. No, you have to be above average. You cannot just do things like an ordinary person. You have to be exemplary. Whatever you do, you go way above what is expected of you. Okay, if it's a matter of doing discharge summaries eventually, and even eventually when you get a job, and I always say eventually even when you get a job as an IMG, you cannot just be, people tend to expect a lot from you, and I find going above and beyond, and it doesn't need to be too much. Like as a clinical observer, remember, most times, like in my situation, I'd only traveled alone. I was living next to the hospital. I was only rostered Monday to Friday, only from 3:30 to 3:30. I didn't have to do after hours. I didn't have to do nights. I didn't even have to do weekends. But guess what? I still offered to come in after hours when my boss was going back in for an after admission round. I still offered to work the weekends. Just providing a set of hands to even give things, to even grab the files, to even, speak to the nurses and pass a plan on and stuff like that is helpful for the rest of the team. So look, you don't have to be off on all the weekends. Offer to your boss and say, look, I'm available this weekend if he's on post-take, because he will remember that. He will remember that you went above and beyond what was expected of you. Offer to stay behind and assist in a clinical audit. Your team is working on to meet a certain target. Offer and say, look, I don't have much that I'm doing this afternoon, this evening. Can I work, stay behind and work an hour or two? I mean, it's for a short period of time. Probably it's 4 weeks, 6 weeks. And if you stay behind, let's once or twice a week, or work 1 or 2 weekends. I mean, it's fine. It is extra, responsibility or extra work, but it will work out in the end for you. So go above and beyond, offer to do things that are within your reach. And one thing that I always say, whenever you offer to do something, do it. Okay? Do it, because that's integrity. You cannot say that I will come and round with you guys on Saturday at 8 and you don't rock up. That's not integrity. You have to offer and do it. Follow it up, and make sure that you are doing it, because that's what people will remember. That's what your boss will remember. When it's time to watch out for you, time to give a reference, they will remember what you did for the team. They're human beings. They will remember, and they will put in a good reference for you. They will remember when they're employing. They will say, oh, actually, Anna was very diligent. Anna did this and this while she was here with us. I can vouch for her that given an opportunity, she will be an asset to the team. So remember, a lot of times people forget what you say, but people do not forget what you do. All right. So even as you hope and forge to or plan to do your clinical observership, I want to wish you really well, and I want to hope that you can use some of these tips and make sure you're not only completing a clinical observership, you're leaving an impact at the end of it, an impact that will allow you to have a job offer when all is said and done. I'm wishing you the very best, and God bless you.